speak Arabic language and of course, English language. So I am a volunteer chaplain with the BJC system, the BJH, work with Lawrence Olatunda. He's a priest from Nigeria. He's very famous, so you might know him. So that is in short, that's, my background. And thank you very much for having me.
And thank you so much for joining us on short notice. We really appreciate you being here today. So now we're going to open up for the questions that we have for the speakers. So I'm going to start with you, Ms. Rebecca. So from your experience and with the work you're doing as a pharmacist and with the work you've been doing with COVID-19 vaccine, why have booster doses been recommended?
So booster doses became necessary because the scientists realized that with time, the effectiveness of the vaccine that we had was winding down. It wasn't as effective as it originally was. And with the new strains of the virus coming up upon us, like the Delta virus, it became very necessary that we should have a booster. And just like the word sound booster, it just helps to increase the effectiveness of the virus that we have in us. That is people who have finished their series. If either you finish the 2 series or you've taken the 1 Johnson & Johnson vaccine that is recommended.
Yeah, thank you so much for answering that. And let's stay a little bit on the topic of effectiveness. So a lot of people hesitancy around COVID-19 is about, I don't know how effective it is. I don't know if it's going to be effective. I heard other people are still catching this virus even though they have the COVID-19 vaccine. So from your research or from just what you know, how did the FDA determine the safety and effectiveness of the Pfizer vaccine, especially when we are thinking about the kids? So right now they've been saying that the kids can get the vaccine as well. So the vaccine for use for our kids, how can we be sure that they've determined the safety and effectiveness of Pfizer, for example?
Okay. So with every vaccine, they have to do clinical trials, whereby there's a lot of people in the studies, and then they give some people the actual vaccine, they give some people the placebo or not the actual vaccines. And then with regular testing, they get to find out who is being protected or not. And then I can assure everybody listening on this that from what the scientists did, these vaccines are very, very effective after the trials that have been done. Moderna and Pfizer are in the 90th percentile of effectiveness. Johnson & Johnson, it has a very good effectiveness of 71% too. And then when it came to the kids too, they enrolled a lot of kids in the study, and again went through the same thorough process they always do to find out if these vaccines are actually beneficial, if they are effective for them. And again, too, they had a very good report that it was indeed very effective, and it was really helping the kids and preventing the disease in them. And they also had 90% effectiveness. And for now, of course, we have the Pfizer vaccine for the kids. So that's where the study was thoroughly done. And it's very effective in the kids in preventing them from getting the COVID vaccine.
Thank you. So it's only the Pfizer vaccine that has been approved yet for the kids, or yes, for that? Okay, just Pfizer.
Yes, currently we really have Pfizer vaccines for the kids. Initially, they started with the adolescents, and just recently they've added the little ones from ages 5 to 11 as well. Yeah.
Okay. All right. Thank you so much and I'll come back to you later. Thank you so much. I'd like to address this list of questions to Dr. Milton. Still on the topic of COVID-19 vaccine. So if a person is vaccinated against COVID-19, we hear that some of them are still able to spread the virus to susceptible people. Is this true?
So thank you. So one of the things that it's important to know is that even though you get your vaccine, it's nothing is 100% guaranteed, and nothing is there's no guarantee. The vaccines work very well to prevent serious illnesses and death, but they do not prevent 100% of infections. So it's still possible for people who've been vaccinated to get COVID-19, and these are called breakthrough infections. And so once you've had a breakthrough infection, then these people can still spread the virus to others. But these so-called breakthrough infections are very uncommon. And it's actually the people that end up with COVID-19 that are unvaccinated, they are more likely to spread COVID-19 to others. Now, the data is still coming out and there's still more to be done. But I think there's been a lot more out there that people are talking about and looking for these breakthrough infections so that they can, I think the data, or rather the amount of information and misinformation too that's out there, people are looking for this breakthrough infection so that they can say, oh, people who are vaccinated are also spreading the COVID-19. But the truth is, yes, there's a small percentage of people that do have breakthrough infections, and they can then subsequently spread COVID-19. But the rate of spread for people that have not been vaccinated at all is significantly higher. So we still do encourage people to get vaccinated.
Yeah, thank you. And staying on the effectiveness of the COVID-19 vaccine. So if I take the vaccine, for example, today, how long will this vaccine last in terms of protecting me or giving me immunity? And how many doses of a COVID vaccine will I need for me to reach full immunity? So
the data is now coming out, and the scientists have found that as time goes on, our body's ability to maintain the immunity that we received from the initial vaccine wanes. So here in the US, there are 3 different vaccines that have been FDA approved. There's a primary series. So for the Pfizer vaccine, which they also call Comirnaty, you have to get 2 vaccines, and those are 21 days apart. And then for the Moderna, you also get 2 doses 4 weeks apart, or 28 days apart. The Johnson & Johnson one, you just get 1 shot. And then in terms of how long after that primary series do you need to get your boosters, for the mRNA vaccines, especially, so for the Pfizer and Moderna, you have to wait at least 6 months to get that booster. And then for the vector vaccine, which is the Johnson & Johnson one, it's at least 2 months for you to get vaccinated. Currently, they're saying just people who have comorbidities or are immunocompromised, their immune systems are weak, or those who have various medical problems, including pregnancy, or those who are at risk of getting very ill, those people are being encouraged to get their boosters. And for those whose jobs do put them at risk, so doctors, teachers, grocery store workers, etc., they're encouraging them to get their boosters. Now, as of, I think today, the Pfizer is applying and trying to, requesting the FDA to approve boosters for everybody. Now, that's a whole different discussion. When you're trying to weigh booster versus trying to encourage primary vaccination, because there are many people who have not even received that initial vaccination.
Yeah, and thank you so much. I'll come to you later. Thanks for answering those questions. Next, I'd like to invite Dr. Michael to answer this question. And I think I would ask you this question because you're physically not in the country, you're in Ghana. So if I get a COVID-19 vaccine in another country, can I get one in the United States?
I believe you mean if you get like the Pfizer first shot and you want the second shot. Yes, I believe you can get, once you have access to the vaccine where you are, you should be able to get one shot in one country. And if it's available to you in another country, within the time that you get the other shot there also, it shouldn't be a problem.
Okay, thank you so much, especially for those of us that we are transatlantic. We are always traveling. So sometimes, like Dr. Milton said, sometimes after 6 months, you need your booster shot. So if you're in the United States and you got your vaccine, or December is coming, majority of Africans will be traveling home. And if you are at home and your booster shot, you need your booster shot. So you're saying you don't have to wait to come back to the United States to get your booster shot. If you can get your booster shot at home, you should be able to get it.
That's correct, because even in the hospital these days, we give people shots when they got their first shot somewhere else, and they come in and say, hey, I want my second shot. We can still give them the second shot. I got my booster shot and flu shot together, and I mean, they're even talking about mix and matching vaccines these days, which might even boost the immunity further. So as long as you can get access to the vaccine and it's required for you, you can get it. Yeah.
Okay, thank you so much. So the second question I have for you is that, what if you have the virus? Because before Dr. Milton and Ms. Rebecca, they've talked about the efficacy of the vaccine. And when we are talking about the issue of immunity, we know that there are stories out there that you can gain immunity either through the vaccine, or you can gain immunity either through that you've been infected by the virus before and now you are okay. So if, for example, I had the virus before and I was okay, do I still need to get the vaccine if I already have the antibodies?
Yes, you do need to get the vaccine. The current recommendation is that if you've been had the COVID-19 and you recover, it is recommended that you do get the vaccination, because we do believe that the vaccination does produce a higher level of immunity, even more than an infection itself. And also the only people who have to wait a little bit is those who get the monoclonal antibody when they get infected. That one you have to wait 90 days before you get a vaccine. But it's recommended that everybody who has had the COVID-19 infection, when they recover, should be fully immunized. I have a couple of doctor friends out of States who got the COVID, and they've all been immunized right now. So it is highly recommended. I mean, just to chip in, I worked in the COVID unit in Springfield, Missouri. It was declared an emergency zone. So I worked as a FEMA doctor over there in their COVID unit. It was a very crazy place. And I did see people who have had COVID and had it again. So I've seen all kinds. So it's highly recommended that even after catching COVID, you do get immunized.
Okay, and thank you for answering that. So my third question to you would be, so in the issue of teams that are student athletes or that are involved in any activity or sports activity, that they have to worry about their internal organs, and they've already had COVID-19. So do this kind of patients or individuals need, especially young teenagers, do they need to get a COVID-19 vaccine, especially if they are worried about the condition called myocarditis?
So myocarditis has come up a bit. It's quite a rare side effect. Well, we talk about it a lot. Do they need to get checked out for myocarditis? I don't think so, unless they're having symptoms. If they do have any symptoms.
And for the sake of our audience, can you just tell us what are the symptoms of myocarditis so that they don't know what to look out for?
So myocarditis, which is basically itis means inflammation. So myocarditis is inflammation of the heart muscle. So you'll be having people coming in with chest pain, with fatigue, tiredness, sometimes some fevers, and fatigue and stuff like that. Yeah.
Okay. Thank you so much. So essentially, if you're not having the symptoms and you don't have any pre-existing condition about that, then you probably, it's very, very rare. But if you have any of those symptoms, then you should be screened for it.
Correct. That's right.
All right. Thank you so much. And thank you for answering the question. And now I'm going to direct the next set of questions to Pastor Paul. Pastor Paul, this is going to be very, very interesting, and me personally, because of my faith, especially when we're thinking about God is in control of all things. And as people that have faith and we believe in the higher power, and we believe that God knows everything. So what would you say to people that are questioning where God is now, especially seeing all of the deaths that's happened and all of the destruction with the COVID-19 vaccine and all of the issues that's been cropping up? And so to people that would say, where is God now and why does he let bad things to happen? What would you say to that? And what would you say to those people?
Well, thank you so much for that question. And I'm laughing because you said especially for you. And you know, I am not the custodian of God. So I think I would probably say everybody is entitled to seek the answer through the faith that you have. I know people have come to pastors, people have gone to doctors, people have gone to magicians, people have gone to sorcerers, and it's a very, very hard question, especially when you are answering on behalf of God, because none of us really know the clear answer that God will give. But just being like you, I can only think through the scripture, because that's where we get our reference. And looking at the book of Hosea, are we having a problem?
I think it's fine now, sir.
Oh, good. I was saying that's a very, very hard question to answer, but at the same time, we have to, just like human beings, we need to seek any avenue that probably will direct us to probably an answer to that question. Why do bad things happen to good people? I have seen, even including myself, seeing bad things happening to us, and yet we pray, and yet we worship, and yet we seek God's intervention, but yet they still happen. But what I can only attest to is our limitation from the things that happen around us. And that's why probably we have to combine both faith, science, and medicine all together, because they complement each other. And by saying that, I'm saying we need to see where faith is leading us to understanding of science and medicine and religion. And at the same time, we need to look at our faith foundation. What is it informing us about the environment that we are living in? And I think that is the basic question. Why is it happening now? And we have been fasting, we have been praying, and yet we have more than 5 million people died globally. And in Kenya, where I come from, more than 5,000 people. And here in St. Louis, just the St. Louis County, more than 12,000 people. And of course, you see even right here in St. Louis City, we have also statistics, and it's happening right even inside the congregations that we shepherd, and it becomes very disturbing really to see that happening, and yet there is God in heaven, and what is he saying and what is he doing? But I'm looking at the scripture here from the book of Hosea, chapter 4, verse 6. It is telling us actually to seek knowledge. It says, my people are destroyed for lack of knowledge. We cannot dispense knowledge, and we cannot ignore the science. And it says, because you have rejected knowledge, I also will reject you. And because God has given us that choice of freedom, either you choose good or you choose bad, then he allows us to make that choice. So if people are dying, and I know some of them are dying because they don't want to be vaccinated, others are dying because they doubt science, others are dying because they think this is the mark of the beast, which is in the book of Revelation. Others doubt because they say, well, this will cause infertility, and especially the young people. But you see, that is what the Bible is talking about. It's talking about lack of knowledge. My people die because of lack of knowledge. And where is knowledge? Knowledge is what God has given us, and especially we have doctors there. We have Dr. Milton, we have Dr. Poco, and all of you, and also the doctors we have here in the church, which we have extensively used to inform people. Dr. Ann is very effective, Dr. Dengele, Dr. Moya, Dr. Mudhoni, and all these other doctors we have here in the congregation. They have been very, very effective. And I have been in the front line of asking people really to get vaccination. I know we can pray. I know we can pray. I know we believe in God. But you see, if you look at the book of James, it says faith without action is dead. So we have to combine faith. And actually James is saying, show me your faith and I'll show you my works, and I'll show you my deeds. I'll show you my actions. So we have a part to pray. We have a part to pray, because if you just sit down there and say, I have faith in God, God will heal me. Yes, the Bible says when we pray, God will heal. But also he's not saying, sit down there and wait for a car to knock you down and you shall not die. No, you will die as we watch. But if you pay caution and you take care of yourself and you listen to the CDCs, or you listen to your pastor who is advocating for vaccination, it's very likely that you'll be saved. I got my first dose, Pfizer. I got my second dose. 2 months ago, I got my boost. And I think I'm proud to show that card when I passed through the airport. And anybody who has, I'm proud to show. And I'm saying I'm a pastor, but I believe in science. I'm a pastor and I believe in technology. I'm a pastor and I believe that I have to play my part with the knowledge that God has given us. Yeah. And you remember that famous Galileo, what he said, that Italian scientist. He said, God has given us reason, God has given us intellect, and he is not asking us not to use any of those. And so looking at that, we can say, yes, let's combine our faith with action, just like what James says in James 2nd chapter, verse 18. He says, show me your faith and I'll show you my deeds. So our deed is to walk to that urgent care, or to go to BJC, or go to Walgreens and get those shots. That is an action. And also as you do that, you pray. So I think faith comes first. Okay. But also faith complements science and technology and medicine. And so for me, I would say God in heaven is watching down, And he is saying, what are you asking for?
Mm.
I have given you, Milton is there, I have given him knowledge. I have Dr. Puko, I have Rebecca there. And thank you so much, Rebecca. And I'm looking forward to see you on Sunday for the vaccination of people here. And all those people, that knowledge they have, God has given them for us to use.
Thank you, sir.
And I'm a firm believer that there is no much separation between faith or religion, science, and medicine, because they are all compatible. So anybody who tells you do not get vaccine, we can pray, you can say, yes, I'll pray, but I'll still get my second dose. I'll still get my boost, because God has given you that knowledge, and we need to use that knowledge. You have heard about people like Mary Baker. Mary Baker is the founder of the Christian Science. I do not agree with everything they ascribe to as a Christian Science, but I do agree and I respect the reason why she wanted to balance faith and science. And so she came up with this Christian Science church or religion. But she was looking at what you call the law of God and the law of good. And so to balance the law of God and to balance the law of good, you have to look at the law of God as the information, divine information coming from God, and the law of good coming from the knowledge that God has given us. So for you sitting there and you have faith, and you think your faith is instructing you not to receive the vaccination, not to go and seek guidance from the doctors, because God will heal, God will miraculously bring this to an end. I would say that you probably will be running out of time before you find yourself like the people I have seen on the deathbed saying, I wish I was vaccinated, and then it's too late. So
thank you, sir.
I'll say in a nutshell, let's have both science,
Thank you, sir. Please, I'd like to ask everybody to mute themselves. All right, thank you.
Can I chip in one short sentence here? I'm very impressed with what our Reverend said here, and he said it quite well. I happen to be in the unique position of being a medical doctor and a pastor, like he's saying. There's no need to separate science from faith, because like he's saying, in the Bible, it's filled with God gave Moses directions on how to heal people. Moses did a lot of miracles, but he also taught them what to do when people were sick. They had spots, they had leprosy. He taught them what to do. So God talked about medicine. He gave people knowledge for medicine. And like he was saying, the fact that you have faith doesn't mean that you should ignore other things. We have faith, but we look left and right before we cross the road. So we shouldn't try and separate the two one from another. And I really like the way Reverend put it, and it's very apt.
Thank you so much. Thank you, sir. And thank you, Reverend. Thank you so much for joining us today. And I'm going to now invite Imam and have him talk to us about, so Imam Mohammed Bashir, who also is a pharmacist, so still staying on theme of merging science with faith. Sir, what advice would you give to other faith leaders in the community on COVID-19 awareness? Because at times, especially as the congregation, sometimes we get differing opinions from the leaders, not just in government or politics or economics, but also in the religion body. So what advice would you give to other faith leaders on COVID-19 awareness, sir?
Yeah, so I think the Reverend and Dr. Puko, said it very well. But, I'll add, there is a famous tradition in Islam that there was a man, he had his camel and he wanted to join the Prophet and the congregation. So he said, "Oh, Prophet of Allah, I want to join you guys, but what should I do with my camel? Should I just, put my trust in Allah, my faith in Allah?" And the Prophet told him, "You tie your camel and then put your trust in Allah. So you do your part. And then after that, you pray to God." And other traditions from the Prophet says there's no disease that Allah has not shown to humanity its cure. And that is another, saying, even, better, you can say, prevention is the best. And there was, I think he was born in 980 and lived until 1038 or 37. There was this, Muslim doctor. His name is Ibn Sina. In the West, he's known as Avicenna. He wrote the book that's called, Canon of Medicine. And prevention, that's actually where the quarantine comes from. Because in the Arabic language, he came up with this thing called isolation. That's 40 days. He was isolating people for 40 days to prevent humans transmitting some organisms, disease-causing organisms, to other humans. And indeed, the Italian merchants in the West got that, and in Latin, that became, quarantine. And what I'm trying to say is prevention, and prevention is much better than treatment. In the tradition, it's also called, in Arabic language, it's called al-wiqaya khayr or ahsan min al-ilaj. Prevention is much better than treating later on. So vaccine is a prevention. Islam tells you prevention, whether it's by isolation, whether it's by avoiding where there is infectious diseases, contagious diseases, or taking medications in order to prevent it. So vaccination is a big part of that. Also, as the Reverend said, Allah or God gave us the knowledge, and Allah gave us the knowledge to benefit humanity. And we should be grateful that where we live today, that the COVID vaccine was produced in such a short time. Even though there are over 5 million people there globally, I think it would have been a lot worse if these vaccines have not been produced. So we're living in a very, good time. We're lucky, and we need to take advantage of the knowledge and the sciences. And religion, or being a religious or faithful person, does not exclude us to take advantage of the current technology and medicine. Even in the Quran, there is a verse that says, وَأَنْ لَيْسَ لِلْإِنسَانِ إِلَّا مَا سَعَى وَأَنَّ سَعْيَهُ سَوْفَ يُرَى. So this says basically, for humans, basically it's what they work hard for. And if you don't work hard for your health, if you don't work hard for, just exact same way we work hard for our future or for our hereafter, then we need to work hard for our prevention and to stay healthy.
Yeah.
And I will end here.
Okay, thank you so much, sir. And thank you for explaining and also bringing it back. I've learned a new thing today. I really did not know where the word quarantine came from, and it's so interesting to see that everything comes from, like we said, and like Maria said, and Dr. Oko said, what you said, that there's no separation between faith, church, the mosque, from science. Everything interconnects and everything fits into each other. So thank you so much for that. So I have a couple of rapid fire questions, and I'm going to ask Ms. Rebecca about, or let's go to Dr. Milton first. So Dr. Milton, rapid fire, rapid answer. Will annual or booster doses of COVID-19 vaccines be needed like the flu shot every year? I feel like that's one of the fears that people have, that every year they'll have to be taking this vaccine.
That's a good question. And the simple answer is yet to be determined. And the research is ongoing.
Okay. All right. Thank you so much for that. And Ms. Rebecca, with your research and with your pharmacy, can you please, for people that want to come to your pharmacy to get the vaccine, they've changed their mind, they now know that vaccine is effective, either your own pharmacy resources or other resources in the community that you can, at the top of your head, just send people to go there tomorrow and get the vaccine?
Of course, come to Darwood Pharmacy, 9944 West Florissant. You will get the vaccine. We have all 3 vaccines in stock. We do have the one for the kids. And that goes for almost all the pharmacies around us, including the small independent pharmacies. Most hospitals have the shots in stock. The health county has the vaccines available as well. So we do have them in almost any place you can think of. We do have abundance of vaccines available in St. Louis area. So please go and take your shot. Yeah.
Okay. Do they need to come with any identification, any documents, anything?
No, you don't need to bring any identification when coming for your vaccines. All you have to come in and fill up your forms. Insurance are not needed. You don't have to have insurance to get these vaccines. They are all free of charge. So please get to the nearest place you can and get vaccinated. And please get the children vaccinated. The 5 to 11-year-olds, please, it's their turn. Please get them vaccinated. So this holiday will be better for all of us.
Thank you so much, and we appreciate you. And that's it for all the questions that we have. I know we are at 8 p.m. right now, but I'd like to give 1 or 2 people in the audience. If you have any question for anybody, this would be the time to ask. You can just unmute yourself if you have a question for any of our wonderful speakers. So the question just came in from John M. Can you take the flu shots and booster shots together? And then we'll go to Joshua. Any of our speaker can answer that if you want.
I would take that. You can take both at the same time. You can even take them both in the same arm, just to get one arm. So studies have shown upon studies that the side effect is no worse than taking one, then going back and taking the second one. So yes, you can take both at the same time. You can even take them in the same arm.
Okay. Great.
And I will second that. I took my flu vaccine and the booster shot at the same day. I took it one on the right deltoid and one on the left deltoid. So no problem there.
Same here.
No.
I took both of them on the same day, left and right.
Okay. Thank you so much. Mr. Joshua?
Hello, everyone.
Hi.
Can you hear me? Hi.
Yes, we can. Welcome.
Yeah, thanks. So, excuse me, my question is about the misinformation. I get many people who come and tell me about the vaccination and how bad are they. And most times, I haven't actually, and sometimes I get them in a discussion about the information. You know, but one of the things that I'd like to know is about how do we fight misinformation, especially in our society, because there are many people who maybe they don't know much about what they're talking about, but sometimes they tell you that they have to fight the freedom to express themselves, and in turn they might influence many people, especially if our parents, you know, they might be scared. So how do we fight misinformation? And what the role of the clergy, you know, the medical doctors, people who have gone to school, how can they able to approach these people in a way that is respectable and they can able to acknowledge that actually what they believe in or whatever they are talking about, maybe probably they need to be more educated about them.
I'm going to call on Dr. Opoku to answer this.
So that's a big question, deep, because as we know, unfortunately, bad news travels faster and further than good news. The internet, I was reading the other day, and there's a group putting out their 70+ percent of most of the misinformation about COVID-19. Since my internet is unstable, can you hear me?
It's better now.
Okay. It says that they put about 70% of the nation out there. Now, the fact that we have some healthcare personnel also involved makes it even more complex. Like, I've run into nurses and doctors who don't want to get vaccinated. We teach them, we talk to them. So how do we come against the misinformation? I guess by forums like these, which Jeffrey is doing, which is very important. Continue to educate people, continue to spread the word. For example, if you talk about ivermectin, I've had people in the hospital who have come in, getting in, and they still sick, some of them die, some barely so entrenched, and it's been wrapped into two things. It's become political and it's also become religious. So it just needs constant education and putting out the facts. Like, for example, they talk about, one nurse asked me, do you know that Fauci and his wife and Bill Gates own Pfizer and Moderna? It's like, look, I don't know who owns what. I don't care who owns what. But my question to you is that even if they own Pfizer and Moderna, what about the Russian vaccine and the Chinese vaccine? Are you trying to tell me they also own those vaccines? Then she was surprised. She didn't think about that. Then we went on to, okay, COVID is a whole state. And it's like, okay, so you're trying to tell me that the whole of America is colluding with our enemies or people we don't like Russia and China, to be on the same page and spread the same misinformation? Then they start thinking and realize that, well, what I was thinking was wrong. So we just need to slowly and steadily get our information out there too. Yeah.
Thank you so much. And I feel like this is such an important question that I'm going to, I don't want us to just move on. So I'm going to call on Dr. Milton to also address this question, please.
Yes, thank you for the opportunity. And I think, Joshua, this is a very good question that you do bring up. And we run into it everywhere. I run into it with my patients. When I see my patients, and I'm a gastroenterologist, I deal with the stomach. And after we've talked about the stomach, I also am obligated to then inquire about COVID-19, because one of the things that people may not know is that even though most people think about shortness of breath, coughing, and fever and headaches, the GI tract, meaning things like diarrhea, nausea, vomiting, and bloody stools, is another way that people get COVID-19. And so when I bring it up and people, that's when you find this, you open a can of worms. And the problem is, like Dr. Opoku mentioned, it ends up being a lot on the political side or a lot on the, religious, or just, and, people I do respect like the government should not be in my business. I do respect that perspective as well. But then I also try to tell them, look, you should talk to your doctor. You should talk to your nurses. You should talk to your medical providers and get your information from the right sources. Unfortunately, the loudest voices, either out in the media, and I tell people somehow Joe Schmo has gotten himself a degree, a medical degree or a public health degree, and now is an expert on something that they don't know anything about. But what I like to tell people is, look, there has to be respect. There has to be a respectful discussion. And I feel that when I come at it from that perspective of trying to tell my patients, I'm listening, I'm hearing you. I may not agree with what you're saying, but I think a lot of times if you just don't give up on them, they may be saying things that in your mind just sound like they're from another planet. And inside you may be just, feeling like, oh my goodness, what am I just don't want to listen to this anymore. But again, I think if you look at it from the perspective of, say, even Christ, like from a religious perspective, just let's be humble, let's welcome everybody, let's think about everybody. And sometimes just by providing a listening ear and trying to refer people to the right resources, and giving, giving information that you know, or that you've researched from the CDC, from the FDA, et cetera, lovingly give that information, and don't fall for the same issue, which is, I think people get so entrenched and feel like they're being attacked and that what you're saying is wrong. Just tell them the facts. Let's try to stick with the facts and eventually try to convince people, but let's not be judgmental. They may be saying things that you don't agree with, but try to lovingly, inform them of what the facts are.
Okay, thank you so much. And thanks, Dr. Opoku, as well, for addressing that question. And Amiola, I see that your hand is up. The floor is yours.
Yes, thank you, Bukola, for moderating. I have
You're
a
welcome.
question, but before I do so, I want to give a shout out to Delwood Pharmacy. My husband and brother-in-law went there today for their COVID booster. And they said it was such an amazing and smooth process. Customer service was amazing. So well done, Rebecca and your entire team. You guys are doing a wonderful job. My question is, I spoke to a physician friend of mine who was advising me regarding the booster that I should get it. And she said, if you've taken the Johnson & Johnson, I'm going to advise you to do the Pfizer or the Moderna this time, just to switch things around, because it's more effective that way. But how true is that? Is it just our opinion, or is there medical facts to prove that we should kind of switch things around? That's it. Thank you.
Anyone can answer?
So yeah, there is, I can't say if there's had, but there has been a bit of research done, was more in Europe or London or something like that, where I remember the initial ones that came out was mixing Pfizer or Moderna with the AstraZeneca, and they got a higher immunity and antibody count than what they did with just Pfizer for the second shot. So now most of my literature that I'm reading about is talking about we call it mix and match vaccines. So they're talking about mix and match vaccines could produce a higher immunity than just going like just the Pfizer or just the Moderna. But I think it's more of not Pfizer and Moderna, but like Pfizer and AstraZeneca, or maybe Pfizer and Johnson & Johnson or something like that. So it is known to produce a higher immunity, but we don't know why yet.
And so I think I will ask a follow-up question on that. So now that we know that, or we don't know why yet, would you advise someone to go ahead and switch up, or wait till more conclusive research comes out?
I'd say they can go ahead and switch over, because one of the reasons is you might end up in a place, like you're saying, we travel all the time. You might have gotten a Pfizer vaccine here. You end up somewhere they don't have Pfizer, they have Moderna. You go ahead and take it. They don't have it, they have AstraZeneca, you go ahead and take it. So all the vaccines are relatively safe. Like it was said earlier on, who started, I believe it might have been Milton or somebody said that the vaccines are like 95%, over 90%, which is like 95, 97. Johnson & Johnson's like 70 something percent. So they are all, and their safety profiles are really good, relatively good. So I would not wait. Waiting is more deadlier than taking the vaccine. Yeah.
Okay, thank you so much. Does anyone else have a comment, a question, anything else that they'd like to ask our speakers?
Yeah, so this is Mohammed. So I've been nicely asking people, who are against the vaccines. I ask them, tell them, that COVID has killed, 5 million people. Can you tell me how many people the vaccine has, killed? Think about it. You don't have to tell me this answer now, but you think about that, and you come to your own conclusion.
That's a good one.
Sure, that's a good point. That's a good point. So I have one question that I've just heard people talk about, I think I should ask you, especially now that the COVID-19 vaccine has been approved for kids, Pfizer. So there's a whole discussion that I've been reading, and some of my friends have been talking about if the kids don't really get sick, if they are infected, why do they really need COVID-19 vaccine? It seems like maybe Big Pharma is just trying to enrich their pockets if we know that kids don't really get sick. So why should I vaccinate my kids?
I'll say one thing, and somebody can answer the bulk of it. So I have a friend, they come to my church, and they didn't come to church one day, and called, and they all had COVID. Father, mother, 2 kids, and an uncle all had COVID. And guess what? It was a 9-year-old who caught COVID in school and brought it home. Everybody in the household got COVID. Now, if that 9-year-old had been vaccinated, the possibility of him catching COVID would have been lower. With him being unvaccinated and bringing the COVID home, if the parents, who are also mostly healthcare workers who have luckily vaccinated, were not vaccinated, there could have been fatalities in the house and it could have been spread. So vaccinating the children is going to break the cycle. The whole idea of vaccination is not just to protect it, but to break the cycle of spread. And now we know with the Delta variant, a lot of kids have been getting COVID in the primary school. My kid's school, one day they sent an email that somebody in his class had COVID. So we just want to break the cycle, and that's the reason why we need to immunize the kids too.
Okay, that clears it up. Dr. Milton?
Yes, I just wanted to touch a couple of things. One, right on the heels of what Dr. Opoku just mentioned. I had a patient of mine who refused to get her vaccination. She was 58 years old. And then her 9-year-old grandchild went to camp, Christian camp. They got COVID, came back home, and then grandma and grandpa both got ill. But grandma, the 58-year-old lady, was unvaccinated. She got extremely ill and ended up in the ICU. And so that's when I got consulted to see her with rectal bleeding. And I'm telling you, it is not a pretty sight when you're seeing a fellow human being gasping for air, and our ICUs were all full and we couldn't do anything. We had to wait for somebody else potentially to free up a room. What that means is somebody else has to die or get better to leave. The long and short of it was she did not make it. And that's a very sad situation, because the 9-year-old who was unvaccinated is the one who got sick and brought COVID back home. So these are real issues that do affect people. So we do encourage people to get vaccinated, and we do encourage kids to get vaccinated. I have a 7-year-old and a 9-year-old, and we've been having these discussions. One of the things you'd be really, when we were talking about vaccines, et cetera, it sounded very abstract. And then my daughter remembered that over the summer, we had to cancel going to Six Flags because they were not vaccinated. And so then she asked me, well, if I do get vaccinated, will I be able to go to Six Flags? Will I be able to go to Magic House? Then I said, yes. And guess what? She said, oh, we're going on Friday. We're going to get vaccinated on Friday. So now it's a very different way that kids do think, but those are real things in terms of being able to go to places that can help you. The other thing to just mention in the forum is that kids actually can get sick. It's very rare, but they can get significantly sick with something called multi-system inflammatory syndrome. And those are kids who end up with inflammation in their heart, lungs, kidneys, brains, skins, eyes, and GI tract, and they can get very sick. Now, I'll say it's not that common, but if it is your kid who is in the ICU or who ends up dying, it really doesn't matter what the numbers are. That is a very sad situation. And we've had, you see parents who are saying, if I'd had an opportunity, I would have done things differently. So I just say, one is to protect our grandparents or older or sicker or people who have immunocompromised systems to be able to participate in activities. 3, school. Right now, a lot of the programs, the way that they're run, if you've been vaccinated and somebody else in your classroom ends up with COVID-19, then some of those those people are not sent home. So I'd rather my kid be at home with, learning in person. So there are a lot of advantages to getting vaccinated, and we still do really encourage it. It's a blessing that we have these vaccines. Some people in other countries would be begging. I'm from Kenya. We had people lining up at 4 a.m. wanting to get vaccines, and then they get really mad if they do run out. So it's a big challenge.
Yeah, thank you so much. And Mr. Geoffrey, you have your hand raised. Oh, you're still muted, sir. Okay.
Yeah, I said I'm Geoffrey Chapkondal. I'm a clinical pharmacist at the Mercy Hospital in Springfield. We worked with Dr. Opoku, and I didn't see him for a while. But the reason for my raising my hand is I wanted just to follow up on what he said and the question that was raised about the booster doses. So if you look at the guidelines, CDC guidelines, the recommendation is if you received any of the mRNA vaccines, that is, if you received either Pfizer or Moderna as a primary series, that is the first dose and the second dose, it's okay, you can switch those ones as the booster. And you should be able to get that at least 6 months from the last time that you received the last second dose of the primary series. Now, if you received Johnson & Johnson as your primary vaccine, and then it's okay, you can switch to either Moderna or Pfizer within at least 2 months. And I thought I just wanted to clarify that. And it's in the CDC and the guidelines on booster doses. I thought I should just specify those 6 months and 2 months respectively.
2 months. Yeah, thank you so much. That's very important information. Thank you so much. So we have a question in the chat that still talks about the confusion of people who have already caught COVID, not seeing the need to be vaccinated. I think we talked about this earlier about, oh, I already have the antibodies. I know I had COVID and I was okay. I don't think I need to get any more vaccine. So if you still want to clarify that, and this would be open to any of our speakers.
So I guess what we said was, if you've had COVID-19, a lot of people are saying I already have the antibodies, so they don't see the need to be vaccinated. Now, even before, and when we had the first or second wave I think it was the second wave, we already did see people, even before the vaccines came out, we already had cases of people who had caught COVID-19 twice, even before the vaccines came out. So we know that even if you've had COVID, you can catch it again. And it's not any easier when you catch it again. And the recommendation now is if you have COVID-19, you do get antibodies. They may not last as long, but you do need to get vaccinated. Let me put it in a layman's term, which might not be medically right, but it's like, okay, you got COVID-19, you have antibodies, but when you get vaccinated, it's like getting a booster. It may make it more simple for people to understand, because when we get vaccinated 2 shots, you get antibodies. When you get a booster, you get more antibodies. So although you've gotten the COVID-19, getting the vaccination actually improves your immunity and makes it harder for you to fall sick again. So it is advisable to get the vaccine. The only time you have to wait after you have COVID is if you got a monoclonal antibody, then you have to wait 90 days after getting the monoclonal before you can get the COVID-19 shot. I hope that clear.
Yeah, thank you. And how will people know if they got the monoclonal antibody?
Oh, it's a treatment. So with the monoclonal, when you go in and you're mildly sick without needing hospitalization and you're having symptoms, they will ask you, and it's an infusion. So they'll tell you what they're giving you. There are different types, but they'll tell you it's a monoclonal, and it's an infusion you get in an outpatient basis. So you will know that they gave you that. Yeah.
Okay. Thank you so much. And I want to say a big thank you to all of our speakers today, Dr. Opoku, Dr. Milton, Imam Mohammed, Miss Rebecca, and the Reverend. Thank you so much for joining us today. This has been a great conversation. And I'd like to say everybody, we've at least gotten one thing or two to take home. I know that personally, some of my questions have been answered, and even questions that I didn't know I had before hearing other people ask those questions. I'm very, very grateful. And thank you so much to all of our attendees today that comes to this open discussion. It's important for us to continue to have this open, honest, and diverse discussion, especially that we are immigrants in this country. Sometimes some of the information that is out there, it might be hard to sort through and even know what is which, and which is why we have this conversation. So thank you so much. I'd like to invite Mr. Sebastian to share about upcoming events.
Thank you so much, the panel and everybody. This was quite awesome. I have to say that rarely do you get into a forum where you get this free information. And like they say that let's treat everybody with respect. Everybody is entitled to their opinion, but not their own facts. So the facts will always be laid out there. Let them get the facts, but let them hold to their opinion. But again, thank you. Vitendo for Africa will continue to do this. This is what we do. We are what in modern world API, you'd call us an interface between the people and the information they need. I guess when you go to the Bible, part of it is my people perish because of lack of knowledge. Here we have people with a lot of knowledge. The physicians we have, the clinicians that we have, I mean the pharmacists, they probably don't consume that knowledge unless we consume it all, and they have space for more information, and we'll continue to do that. Vitendo for Africa has chosen to take that path so that we can at least reach everybody who needs this information or is not able to reach organizations, just like you heard about the Deadwood Clinic. You know, if you need a place to go to get your vaccination, if you need a place to go and worship, if you combine worship and vaccination, I think that's a very good booster also. You know, once you get your booster, then you have God. And I think that even concludes the whole process of vaccination. You have the whole process of protecting yourself. Now, let me invite everybody who is here and tell you that we have our dinner. That is the December 18th. The Vitendo for Africa will be holding a dinner. We would like to invite you.
Hey, what's up?
Who, me?
Another day in paradise.
Oh, wow. That guy must have enjoyed this. You must have enjoyed. So let me invite you for our dinner, December 18th. We will send you the information. If you would like to support Vitendo for Africa, if you're in a position to do that, like for the dinner, we have tables that are going for 400. That is about 8 people, but the plate is going for $55. And we have to thank Alinora for the good organization that she has done for us. Again, I want to give a big up for the church and the professionals that we have in our society. Thank you so much for your support. And I will go ahead and now hand it over to our CEO, our Director Geoffrey, and again, tell him thank you for putting this together. And for the panel and the moderator, thank you. May the Lord bless you. May he give you knowledge and wisdom to continue doing this. And guys, continue touching lives and never get tired. Keep treating and God will continue healing. Thank you.
Thank you.
Thank you so much. I think it's almost 8:30 now. I want to say thank you to our panels and everyone who logged in tonight for all the time you've been with us, even every time we call you. I know sometimes you call a couple of meetings, but you never get tired because like everybody has said, information is power. And when you have that information, what we can say is that be generous with that information and talk to people that you interact with every day, because you also don't want them to get sick when you had some information that could have helped them. So reach out and be able to connect. I think Pastor Paul mentioned that we have an event on Sunday. If you can come at the Christ Covenant Church, I think Pastor Paul, you can post the address on the chat. That will be for all the kids and also the adults, those who are also getting booster shot, but also who want to get the flu shot. As an organization, our job is actually to keep you connected with resources that will help you stay healthy, but also improve your quality of life. The other thing I want to mention is tomorrow on Thursday, we have our next Meet the Other speaker series, which is this time will be Ari Benson from International Institute. He's the author of Bridging the Gap, the Opportunity Gap. I will invite you again. We'll be able to share that. I think as on the chat there, I put the events, the link that connects you to our event page. You can also be able to see other events that are coming up on December 2nd, December 1st, but also on December 18th, like Sebastian said, we invite you to come and connect with other Africans here in St. Louis. Invite your friends, the Americans' friends that you hang out with at place of work and in your neighborhood. It's a great opportunity for them to come and for us to be able to share our rich African community, but also helping them understand the value that we bring in the region, that we are not here to take away resources, but we are here to add value into the region. Other than that, I'll say thank you so much. Enjoy your evening and see you next time.
Thank you.
Thank you, guys.
Thank you very much.
Aye.
We'll see you guys later. Have a good evening.